Welcome back. This is Dr. Jin Sung, and this is part 1 of chronic fatigue. Last week we talked about 9 different reasons why you might have chronic fatigue, and this week we're going to go into it in a little bit more detail and go down the list, right? So before I get started, my name is Dr. Jin Sung. Our practice is located here in Methuen. We specialize in the complex chronic patients who have neurodegenerative disease along with metabolic conditions such as autoimmune disease, hypothyroid, etc. Many times people come in and they have chronic fatigue as a primary complaint. And people don't understand the underlying mechanisms as to why someone might have fatigue. Fatigue is usually brain-based. It's not just I am tired because I did so much work, but I'm exhausted even if I get rest and sleep, right? So fatigue is very different. So when we look at chronic fatigue, we look at the brain. And the number one on the list here is oxygenation. Are we getting proper oxygenation to our brain or even to our peripheral tissues, into the hands and feet, right? We need proper oxygenation. And the way to test for this is to do proper testing in terms of lab markers. This will help us distinguish between all the different types of anemias, all right? So why do we need proper circulation, okay? You have to understand the blood will carry oxygen to all your tissues, but it also carries your nutrients, right, to the areas that it needs to get to. It provides the sugar to the brain. Okay? So without proper circulation, you're going to have issues, and no matter what you do, no matter how much exercise you do, no matter how many organic smoothies you have, it doesn't matter. If you don't fix the anemic condition, you're not going to get better, right? So one thing we need to look at is also blood pressure in terms of if it's too high, it's a problem. But what I find is people who have anemias or poor oxygenation, they usually have low blood pressure. So if you have cold hands and feet, toes, nose, right, you may have low blood pressure. You might be that patient who gets up too quickly and then they feel, whoa, I feel a little wobbly and woozy. And then about 3 seconds later, they're okay. Their blood pressure is low and is not getting enough oxygen or blood flow to the brain. So blood pressure is a very important part of oxygenation. So we have to look at that. But let's get into the anemias, right? In order to do the proper testing for anemia, you have to run the proper panels. What I find is most patients who come in, they come with their blood work from their doctor and it says, oh, everything is normal. Yet many of the markers that we need to look at are absent. It's missing. Crucial pieces of the puzzle is not there. So how are you supposed to find an anemia or an oxygen issue if you don't have all the markers? It drives me up the wall when people come in and they're like, oh, there's nothing wrong with me. Well, you didn't have enough testing to figure out what is wrong with you. What is the cause of the chronic fatigue, right? So in order to figure this out, you need to run the proper tests, okay? You need a red blood cell marker, hemoglobin, hematocrit, serum iron, ferritin, total iron binding capacity, transferrin, right? Iron saturation. If you suspect a bleed somewhere in the GI tract, you might have to do a reticulocyte count. And then if you suspect an autoimmune condition that might be causing anemia, you have to look at intrinsic factor antibodies, right? I just named off a bunch of them. What I'll do is I'll subtitle the video so you know the spelling and the correct words that I'm just spurting out here, because a lot of people don't understand what we're talking about here. But if you look at it, there are a bunch of different markers that you can utilize to determine if you have an anemic condition. Basically, poor circulation and oxygenation. You need oxygen. Think about it. If you get choked off, right, how long would it take for you to pass out? You ever see the MMA fights? these fighters, they choke each other, right? They get in the choke, and then 3, 2, 1, they can be unconscious, right? It's that quick. If you don't get oxygen and blood flow to the brain, you're going to pass out. But if you have low-grade oxygen deficits, it's not so obvious, right? You might just have chronic fatigue. I'm tired. I don't know why I'm tired. Right? So you have to check red blood cell, hematocrit, hemoglobin, serum iron, ferritin, total iron binding capacity, transferritin, iron saturation, reticulocyte count, and intrinsic factor antibodies to truly determine if you have an anemic condition. If you haven't done it already and you're always tired, maybe it's time, right? Because you can have different types of anemias depending on what numbers are elevated or what numbers are depressed or low, right? You can have something called polycythemia, hemochromatosis, pernicious anemia, megaloblastic anemia. You might have an internal bleed. You can have a sideroblastic anemia, anemia of chronic conditions or chronic disease. You can have anemia due to liver dysfunction, right? In those cases, you need to run liver enzymes to determine that. Do we have, chronic viruses that attack our liver, like hepatitis, right? Or we drink too much alcohol and the liver is suffering. So if you look at the number of different types of anemias and the number of different types of tests, you need to figure out what's high, what's low, and determine what type of anemia you have in order to get to the root cause, right? Because some of them may need B12 injections in order to fix their anemia. Some of them may need just iron supplementation to get the iron levels up. Some people will need a whole systems approach where they're not absorbing nutrients in the GI tract. So you have to be able to fix the gut. So when you're chronically fatigued, anemia or oxygenation is a critical factor. You have to optimize that for you to heal. Without it, you can't, right? If you try to run, right? Try to hold your breath and run. See what happens. 30 seconds, a minute. See what happens, right? If you get low-grade oxygen deprivation, you're not going to feel well. You have to fix the underlying mechanisms, right? Find the anemia. What is it? Is it a bleed? Is it B12? Is it iron? Is it a liver issue? What is it? Figure that out, and then your oxygenation will improve, right? And your chronic fatigue may lift, okay? Next week, we're going to talk about blood sugar, right? The highs and lows of blood sugar and how it affects chronic fatigue. You want to tune into that one. I'd like to thank everybody who's been watching and commenting. Please like and share this page with your friends and family so they can get the good information that we're talking about. Again, look for subtitles. So I just named off a bunch of different things that might not make sense or you don't understand the terms. So I'll make the subtitles on the video so you can see the words, okay? Have a great day, and we'll see you next Tuesday on the Healthy Side. My name is Dr. Jin Sung, where clinical excellence meets excellent results. See you later.